Hi everyone, this is Dr. Tanushree Pandey, an obstetrician and gynecologist. I'm based out of Mumbai, and on Instagram I'm popularly known as your gynae guru. And today I'm here on MissMalini Girl Tribe to talk to you about something very important, a topic which has gained a lot of momentum in today's day and time, which is in vitro fertilization or IVF. What is IVF? Why is it needed? When is it needed? How can you go to an IVF specialist and how can it help a couple in conceiving or having a baby? Before that, we need to understand what is infertility. So if a couple is trying to conceive for over a year, or if a couple is over 35 years of age and is trying to conceive for over 6 months without the use of any contraception and is unable to do so, it is known as infertility. And once we've decided or we figured out that the couple is facing problems with infertility or subfertility, we must seek professional help in a gynecologist, and especially one who specializes in infertility and cases similar to this. So we must know that infertility can be due to the male factor or the female factor, wherein the semen, there's a problem in the semen report in male factor infertility, and in female it can be everything from the uterus, the fallopian tubes, the ovaries, hormonal or endocrine as we say it, and sometimes unexplained. We are unable to know why is the infertility happening. But we have a series of events, a series of tests that we go through, certain lab tests, certain, something that is known as a HSG or a hysterosalpingogram, sonography, ultrasounds that your gynecologist is going to run you through, and we'll eventually come to a diagnosis. Once we know that, we go ahead with infertility treatment. And the spectrum of infertility treatment is known as assisted reproductive technology. It ranges from something as basic as ovulation induction, wherein we just give you some basic drugs and help you in releasing the egg. It can go up to IUI or intrauterine insemination, wherein a fresh sample of the semen, a concentrated sample of the good sperms is prepared using the semen sample of the partner, and which is put inside the uterus of the female partner. Then we come to in vitro fertilization, wherein we take the egg and the sperms, we do the fertilization outside, which is in vitro. In vivo means inside the womb, in vitro means outside. And then the embryo or the fetus that is formed, we put it back into the uterus. Now this is what is IVF. And then there is another method which is ICSI, intracytoplasmic sperm injection, wherein when the sperm count is very less, we take one single sperm and inject it into an egg so that the chances of developing an embryo or fertilization to occur further increases. So this is the wide spectrum, and in some cases where the uterus is absent or there are certain malformations of the uterus or some other conditions wherein there is unexplained infertility and we are unable to rule out why it's happening. In that case, surrogacy is also an option, which is commonly known as a womb on rent, right? So wherein the egg and the sperm of the couple is taken, the intended couple, and a surrogate is used, and that's how the pregnancy occurs. So this is the wide arena of IVF and at different stages wherein we can help the couple. So mostly the message that I want to come across today is that stop blaming yourself. Stop feeling guilty that, why am I not being able to have a child? There's a problem in me. I'm not ready to face it. The pressure of society, the pressure of in-laws, the pressure of partners. We have to overcome that. At the right time, we have to seek the right help. Because, you have to know that the woman is only born with certain number of eggs. So the number of eggs are already decided even before her birth. So there are not going to be any more eggs that are going to be prepared. And thus it is very important that while those eggs are there and while the fertility age is still remaining, we catch hold of the problem, we treat it, and we treat it well. So if you're a couple, if you're a person who's facing subfertility or infertility, I urge you to go and take the right help, because there are a lot of options available, and I'm sure your gynecologist will be able to help you. To know more, don't forget to follow MissMalini Girl Tribe and me, Gynae Guru, on Instagram. You can also consult me online or offline if you're based out of Mumbai.